decided to go to Costa Rica, it was just a really great opportunity because I hadn't really had the chance to do much abroad work when I was an undergrad, and this was just perfect time, fit right in with spring break. And I felt like this is one of the few trips where I felt like I could really do something despite not speaking a lot of Spanish.
Our mission was originally to find out a lot about the children of the community, go interview households to see about the kids and their level of education and if they had any chronic diseases. San Jose, Costa Rica was like the big city, but then there was like communities within it. And so the name of the project is Project Alajuelita, but the actual community where we spent most of our time was called Los Pinos.
It's not even, I don't think it's actually designated as a specific community because the Costa Rican government doesn't really recognize them. I mean, the kids are allowed to go to school, but in general, I think the attitude towards this community among other Costa Ricans was that they were second-class citizens.
They were there illegally, and it's just amazing that they had such a good outlook despite the fact that they were completely disenfranchised from their country, because they have a system in which they provide health care for everyone, all citizens of Costa Rica. And so they see people around them that have access to health care and a really great life, access to college at a very cheap price, and they have none of it.
A lot of what we did down there was promoting just basic health care, like hygiene, self-esteem, mental health.
We actually would go into the people's homes, which usually, tin roof, I don't know, not what we're used to here.
While we were doing our surveys, I went in and met with a lady who had really horrible pulmonary disease. And in front of her house, they were actually just burning trash. And she wasn't capable of actually connecting the two.
Because there were 9 of us, and there were a few people at the community down at the clinic anyway, there wasn't a huge need for us to have clinical responsibilities. There was one primary physician, and then we have 2 people in the morning who would work with the physician, help take histories of patients, and administer medicines, antiparasitics. The other half of the group would spend a little bit of time coming up with what we were going to do some sort of educational session for the kids later in that day.
The skit was the major project. That was probably the last project that we did there.
Yo quiero ser astronauta.
Astronauta, no puedes lograr nada. Eres tan estúpida.
Oh, no.
They don't think they have very much hope of getting out of their communities, so emphasizing that you can go to college and you can set goals and you need self-esteem to do these things.
The littlest things that you could say to these kids, the littlest skit, it just makes such a difference because everything around them is telling them that they're just going to stay confined to poverty in this little area.
I think going to a community like that really emphasizes the importance of public health, and where medical students might not realize that so much because we have more of a narrow focus of just treating the patient, that it all starts on a public health level. And I think especially in communities like that, the most impact can be made on a community basis.
I think it was like a landmark experience of my first year. I couldn't imagine doing medical school without having gone on that trip. It kind of defined just kind of a mindset to begin with. We're doing this for more than just so we can treat the scan. I think that to not go on a mission, you're really missing out. I would definitely recommend to take as much opportunity as you can. There's resources just like Global Reach who will help fund trips. To ignore that is to ignore an entire aspect of medicine.
I talk to upperclassmen all the time, and a lot of feedback that I get is that you're really going to regret having not done some things earlier on in your curriculum, because being a physician has a lot more to do with who you are as a person than the knowledge that you learned while you were in medical school.